Okay, great. Well, good morning. I'm so happy to have Melissa Levin here. I'm excited to hear about her program. If you don't know me, I'm Maura Sullivan. I'm the director of Operation House Call, and this program through Dana-Farber is so exciting for us to learn about, since our focus really is around inclusive healthcare. And so we welcome Melissa, and I have Jonathan Gardner and his mom, Nancy, here with me today. And we're just excited to hear more.
Thank you. Thank you so much. Thank you, Jonathan, Nancy, Mara, for your time today. So, I am a senior social worker at Dana-Farber and representing our Neuro-Inclusive Oncology Care and Empowerment Program. And I'm really grateful to have the time to speak with you because inclusive healthcare and health equity for people with developmental disabilities is my absolute passion. And I'm coming into this role, I'm just coming up on 1 year with Dana-Farber after many years in developmental disabilities, both as a school social worker supporting transition age youth and also working in participatory action research at Boston University. And to be honest, I never imagined myself in oncology until a few years ago. I had a number of families who were facing cancer. And as I was trying to provide emotional support and just some help navigating the system, I learned that there really wasn't much out there when it came to being neurodivergent and having cancer, or even when it came to um, kids and adults with developmental disability whose parents had cancer, and just understanding there is so much information that can be confusing. There are so many changes to routines, to physical appearance, to communication. It just impacts everyone when someone's life is touched by cancer. And as I was going through the motion supporting families, um, I came to realize the health inequities that people with developmental disabilities face when they are experiencing cancer. And I learned that Dana-Farber had this initiative where they wanted to not only, recognize these inequities and, problem solve and get people in for timely care, truly accessible care, but that Dana-Farber really wanted to be this leader and like, how can we raise the awareness of these inequities? Let's identify what are the best, most inclusive practices, and then let's try to share this information, with as many people, as many places as possible, so that we can work on this, as a much larger system rather than just focusing on it in the Boston area. So when I came on board to Dana-Farber, I've been learning all the ins and outs with oncology and all the different disease centers and learning from my social work colleagues. And one thing that I loved about this initial work on our neuro-inclusive program is including patient family advisory council members, people who identify as disability advocates, really hearing from the community this full representation, right? If we're going to make something that's for people with disabilities, we need to include the perspectives in every step of this process. So I would say, as a community, we came together and are building this program and actively accepting referrals, working with patients, and just continuing to get the word out.
Wow, that is so amazing. We are so grateful for this work, and I love that you're including the people with disabilities and the lived experience as you grow the program. The person who really has the most incredible lived experience and journey is here with us today, and I'm really excited for him to share a little bit about his journey and just what he's learned, and now what he's able to share with medical students and nursing students through our program. But Jonathan, did you want to just introduce yourself a little bit and about your journey?
Sure. Well, hello everyone. I'm Jonathan Gardner. Some of you might already know that already. And I'm a self-advocate, cancer survivor who happens to have autism, and also wear a couple other hats when it comes to organizations. Uh, I've always I always believe, what was I gonna say? Give me a sec. Sorry, my brain is not working today.
You're good.
It's
So
okay.
Yeah.
I think what you want to maybe share is, a little bit about your cancer journey
Yeah, okay.
and maybe start with how you got diagnosed.
Sure, I can go with that.
Yeah, that'd be great.
Okay. So, when one day when I was out with my mom on a walk to basically get some happy chemicals, as we like to call them, um, my legs started to hurt when I took a step. Me and my mom thought it was a Charlie horse at the time, and from that moment, my life changed because that pain would not go away. We tried new sneakers. We tried ointments. We tried, let's see, stretches. We tried so many things. Heck, we even tried a hot tub. Uh, True story, by the way. But nothing would seem to heal that aching feeling. So eventually, we decided to go to the doctors, and it was a very frustrating time because I kept being dismissed, and most of them didn't even look at me. They just talked to my mom right out of the way. And even one said to my mom to take me to a psychiatrist because they believe I'm crazy. And and I wish at the time I could say, show me I'm crazy. Don't just say that I'm crazy. Eventually, we were able to meet by the grace of God. I truly do believe this, by the grace of God. Uh, we were able to meet a Dr. McGinnis, was it? Yes, I just wanted to make sure I got the name right. Dr. McGinnis, and she looked me right in the eyes and told me, Jonathan, I do not know what the answer to this all is, but I'm going to try my hardest to help you figure this all out. And from there, I had to take a total of 3 MRIs because where the let's just say where the now, since we already discussed that am a cancer survivor, where the tumor was causing me so much pain. They kept dismissing and saying, "Oh, it must be the loud noises or the lights or something, those things." When I kept telling them, me specifically, not my mother, kept telling them that it was the pain. Finally, for the third MRI, I was finally sedated, and that is when I found out I had Ewing sarcoma, a rare form of cancer.
Yeah.
Yeah.
Just amazing, Jonathan. One of the things that we focus on when we talk to the medical students about this story is the idea of diagnostic overshadowing and the fact that they see the autism and that's all they see. And they make assumptions around that and how dangerous that can be when there's an underlying medical condition. So glad you finally got that MRI and diagnosed. I have a question about how you work with patients and their families, just around the challenges of communication, especially because I feel like that's one of the most important things to people with autism or intellectual or developmental disabilities in their families is getting good communication from their provider.
Absolutely, absolutely. And that the communication is the foundation. And I think, Jonathan, I'm so sorry for what you experienced and that your voice, wasn't heard, for the invalidation that you experienced. And I'm so grateful that you eventually matched up with a provider who, saw you as you and this whole person, was like, we're going to figure this out together. So you highlighted a few things that I want to bring in as, examples. The first is you talked about how when you came in initially, providers weren't talking to you. They were, talking to your mom. And so what I've been working on, and we're doing a lot around, training with our providers, just building the knowledge, building the comfort level, working with people with IDD, is like, you are the most important person in the room when you are the patient. And so, yes, you may have a care partner, as many people, both people with disabilities and neurotypical people often have in cancer care, because again, you're not feeling well, it's fatiguing, etc. Even when the care partner's in the room, you are the most important person. Let's hear from you in whatever way you communicate. Maybe that's out loud. Maybe that's in writing. Maybe that is text to speech. Maybe it's through assistive technology. Whatever way it is, we want to hear from you as the individual, as that most important person. And then if you come with a care partner, it's like, tell me about who you're bringing. And, oh, can we also check in to hear from, mom, and what's mom's feedback on this? But that, we've got to make communication this truly inclusive experience and meet you where you're at coming in. So, that's one part of it. And the other piece that I've been working on with providers is developing some social stories. So some of these like written tools, visuals, that if I know, okay, there's going to be a lot of information coming out in a visit, and it's going to be about different treatment options, or it's going to be about having an MRI done or radiation, that I'm going to work with the providers, do some like behind the scenes work to be able to take what is just so much information, so complicated, and just bring it down to a more understandable, like actionable um, plan. So I work with providers on that, and I am, along with our social workers, we've got this varied approach where we can be very hands-on if that's what is needed, if that's what's determined between the patients and the providers to be the best fit, or we can kind of be like in the background available to consult, but it's really about what works best for that person, for that patient, for that medical team. Thank you.
That's fantastic. I'm going to dig in a little bit more around communication. I
Yeah,
love
yeah,
what you
absolutely.
said. It's something we say all the time, that the patient is the most important person in the room. And regardless of their ability to communicate verbally, I have two sons with autism, and one of them has profound autism. He's nonverbal. And I find that, that's almost an immediate reaction of providers, is to just turn to me. And he is nonverbal, and he doesn't communicate well with any kind of written or device. He has a device, but he will tell you something like, I need space, which
Yeah.
I understand. But, I still feel that he can communicate very well with his body language, his gestures, and just always directing the conversation to him, makes him feel included and respected. And I believe that he is able to process some things. So it's worth trying to do that for sure. So I'm sure that you've had some really folks with some really challenging communication limitations. And how do you address them?
Yeah. So it's a great question. So at this point in our, since the formal programmatic launch, I haven't had a patient with that particular profile. Now, yes, many patients have been seen over the years. We know that patients with IDD exist in oncology, but I will say, since I've come on board, we haven't run into that situation just yet. But I would say, what we are going to do when we find ourselves there, which we will, right? Absolutely, is to be as proactive as possible, like leading up to that medical visit, that can we get some, collateral information from family or whomever is, that close trusted support about, well, what can we look out for to know if someone's feeling comfortable or uncomfortable in the room. And so let's talk about how does this person show if they are experiencing pain and they are nonverbal. And we want to like collect all that information and what I call like our neuro-inclusive initial assessment, so that I can be able to share that, with the providers, and that we really are as thoughtful as possible in making the visits, comfortable, where we can get the information that the providers need to get, that the families, patients are able to also feel comfortable, asking the questions, just for that two-way communication. And again, whatever communication style is going to work for that person. And in situations too, like I've had patients who may not live with family, but live in a group home. And so again, we're then including group home staff, with the patient's consent or with a legal guardian's consent, because there's a lot of really valuable information that can really support that person.
Melissa, absolutely. I am so glad that you're willing to work with everyone on the whole entire spectrum, to really address their individual needs, because that's, I have another son who, is able to communicate a little bit, but still needs a lot of caregiver support. And so one of the things we talk a lot about is, really that partnership with the care provider. And I know that was really important to Jonathan as well throughout his journey. And I don't know if they want to jump in a little bit about that piece and how that worked, and maybe even, mention supported decision making as a way to get through this as well.
But for the main point, let's talk about the visit restrictions and well, since that correlates with COVID-19, that also as well. So when me and my mom and dad were all planning on going to meet my doctors for the first time, we came up with a plan just in case it was overwhelming. Basically, the plan was if it ever was to get too overwhelming, I could leave the room and process all the information as my mom and dad would gather all the information for me. And then I would be wheeled back because I was in a wheelchair at the time. And I would give the information broken down by my mom with the help of the doctor. Sounds like a great plan, right? It was just one, actually a couple of problems with uh with this. One key one, but first, visitor restrictions. Two, I was over 18 at the time. And three, we forgot to tell the doctor.
No.
So, to fast forward the story a little bit, let's just say my mother worked her voodoo magic and was able to get all three of us into that room. She's a miracle worker, I swear. But from there, the doctor came in, and I still feel so bad for this man to this day. Uh, he came in and he saw three people, height of COVID, and a guy over 18. So after a little bit of explaining, we basically were able to move forward with it. Uh, but after a little bit, I had to leave the room because, well, the information was overwhelming. And the doctor didn't really know what to do, but after seeing how I was doing, he's decided to take a leap of faith on me because, well, I think we're all aware of HIPAA, uh, and decided to let me go into the, what was it called?
Waiting room.
The waiting room and process all the information. And honestly, before I left the room, we had to explain supported decision making. Now then, what is supported decision making? Well, it's an alternative guardianship where the person, me, is more in control of my life. Think of it similar to how a business works. How, for example, I am the CEO of my life, and then there are subordinates that would help me with my orders. Such, for example, let's use my mom, for example, since we're talking about healthcare. She's not only my healthcare policy, but my healthcare supporter. She helps me with my healthcare decisions and keeping up with my medicine and all that stuff. And that's just one example of it, basically. Let me think.
And was the hospital aware of supported decision making when we got there?
No, it was not. But after my mom basically mentioned that she could call a lawyer, uh, they basically let me go out, basically. And still feel bad for this man to this day, but I still love him for doing it, honestly. But yeah, where was I?
Learning experience for him.
Learning experience. But
Okay.
but yeah, though. But yeah, I was wheeled out, able to process the information. My mom was able to gather the information needed. Then I was wheeled back in, and from there, with the help of the doctor, my mom and dad were able to explain the situation to me. And then afterwards, I will mention this one thing because I do believe it's important, at least for future questions like that, since I'm on the topic of it. The doctor noticed that I had a gaming laptop on me and started to slowly bond with me through that. I just thought that'd be a very important thing for when I'm the one asking questions. So
Why was that important to you?
because it started to build the rapport between me and the doctor. For example, when you're trusting someone with your life, would you at least want to know that you can trust them in some type of way, even if it's something as small or inconsistent as, oh, cool, he plays video games as well. like something like to make it more human, if that makes sense.
Absolutely. I noticed, that it was so important for Jonathan to be able to have his mom break down the information, and then relay it back to him. And some of the ways you even did that, Nancy, were through like social stories and things you worked on at home as well. So it's really great to hear that you guys are putting together social stories for the patients. And I think it does get really challenging for patients who don't need guardianship, but need that really extensive support when they're going through something so intense like that. So I'm sure you will run into some of that if you haven't already.
Oh, absolutely. Yeah. And Jonathan, just like what you shared, I've worked with a number of people who have fallen into that supportive decision making um, experience. And just like you're saying, it's about coming up with, okay, so what's our plan going to be? Am I someone that wants to have all the information at once? Am I somebody that wants to have it in chunks? What am I going to say? Or what's my gesture going to be when like I'm overloaded? I got to step out. And then when I step out, what's going to happen at that time? So all of these like really important considerations that you made and you made with your family are the same kinds of considerations that we're also thinking about at Dana-Farber with our patients with, whatever their kind of support system looks like, and with the providers. And we're doing a lot of education with our providers around the different decision making. Because just like you said, some people know it, some people get it, and some people don't. So we want to make sure that there is an awareness. About that, and we're definitely partnering with families and with patients when it comes to the social stories, because sometimes, like you mentioned, there's already a story or a script or something that the patient already has in place. And then it's like, awesome. How can I, if you want support, how can I support you, and continuing that with all the complex information coming your way about what the diagnosis is and what the scans might be and is sedation indicated, et cetera. So much there to break down.
Well, I'd love, Jonathan, for you to jump in on just what you were talking about, the questions you had around, when you actually got into treatment and trusting your providers, and anything you want to ask.
To effectively communicate care plans, medications, and support networks for patients with disabilities during their cancer treatments.
Sure. So I think when it comes to strategies, it really depends on each particular patient, and we need to learn, we do with our initial assessment, like how does the patient want information coming in? How do they learn best? What helps reduce stress and anxiety, which everybody facing cancer has to some extent. So we need to like piece together all the different pieces about what's going to be most supportive for that person. And then our team can get to work that what are the visual supports that might be helpful? What are the written supports that might be helpful? What additional consultation or training would be helpful for us to provide to the providers? How about when it comes to pain assessment and pain management? Like how are the pain scales working, or the way that the providers are checking in about pain? And does the patient feel like the pain scales are accurately representing, the pain that they're feeling? So again, it's like depending on each person, we're then going to piece together really individualized supports that will help that person, just be fully included and just fully access the treatment and make sure that they're truly understanding the information as it's presented to them.
That's so great. I wasn't going to jump in again, but I just wanted to say, I love the idea of really doing extra work around the pain assessment with the patient and their family. I think, I pray I never have to go through this, but I know that there will be pain in the lives of my kids at some point. And I have one of my sons who will, if you ask him, does it hurt? Or how are you feeling? He pretty much always will say it's better. Like that's his response, right? He just thinks
Yeah.
that's what he's supposed to say, and that will make everyone happy. And
Yeah.
so it's really important for me to be able to, relay the other cues that I'm seeing, as a parent, as someone who's watched his cues his entire life, So I really appreciate that because it is true. Everyone's so different. And for my older son, you know, there's a lot of behavior when pain is present. And I think that really can be so challenging for providers and how to manage it and how to help the caregivers get through that as well.
Right. And that's another piece too with the diagnostic overshadowing. So if there are like behaviors popping up, if there's something unusual, let's not attribute it to the autism or the developmental disability. Like it's it's trying to represent something that the person is experiencing. So like let's dig into that. Yeah.
Thank you.
Yeah,
Sorry,
of course.
Jonathan. Go right ahead.
But yeah, though. So during my I guess cancer diagnosis, it was extremely hard for me to sit still. So it was extremely hard for me to play video games. Heck, I even had to sleep lopsided for just to be able to go to sleep.
Wow.
But yeah, though, from there, they kind of decided to find a system that could gauge the pain. And that was through video games because you would have to sit still for them and well, maybe depends on what type of game, but mostly for most games you have to sit still or all that stuff. But being able to play a game, because with the tolerance of pain combined with trying to focus on the gameplay, it'd be pretty hard for that one, honestly.
And it was just, if I can just jump in, they would show him the scale. I remember there was like happy, and there was like a scale of smiley faces that ended up being sad. I don't even know if you remember. And it was just
Yeah, I
a
remember
lot
it.
for him to process. And so one of his nurses was just like, Jonathan, you like video games. How many video games had you played? And there were many, many days that he didn't play any. And that is how they gauged his pain. And they kind of phrased it as, how are we going to bring joy back to Jonathan? So,
And that's such an example of person-centered care, right? That
yes.
there are pain assessments that exist, but they're not necessarily going to mean something to every single patient. They're not necessarily going to represent what we're looking for that then impacts like treatment decisions. So for someone to really like build the rapport with you, get to know you and figure out like, wow, if we look at video game playing, this is going to like represent if he was able to sit, which is going to show us then about the pain level, how long he's able to stay seated. And just like what you're sharing, I've had some patients where the Wong-Baker face scale totally works. Okay. I've had other patients where, nope, it doesn't work because the feedback I get is, oh, well, my face is never going to look in the same way as these faces. So how can I make this judgment based on this scale? I've also had folks who have shared, some folks who love art and love colors, where it's like a color scale, and it's how intense is the red or how bold is the number. Like there's all these different creative ways that we can look at pain assessment with people who have developmental disabilities. And again, it's this communication with the patient, with the providers, with the team. Like, okay, is what we're using to assess pain, is this truly assessing pain? And what can we take from this assessment? It's a really neat
Yeah,
example, Jonathan.
and if I could jump in for a second myself, like that just kind of reminds me of a saying that we have in this household. You meet one person with so I'm just going to modify it a little bit since it mostly talks about autism. But on this case, when you meet one person with a disability, you've met one person with a disability. Well, different whether we have blue cuddly creatures or not. Uh, yeah, and that's the thing with care. Everyone's different. So you have to learn on the way. Sometimes it could be hard, sometimes it could be easy. It's all about the person at the end of the day. And you always have to keep to that because at the end of the day, we're all human, regardless if we have a disability or not.
Absolutely.
Amazing. Amazing. Do you have other questions, Jonathan?
Uh, how can healthcare providers ensure that at the beginning of a cancer journey, patients who happen to have autism or IDD are asked about accommodations, adjustments, or supports? And did we already answer this question?
No.
Oh, okay. Or support people needed during appointments or treatments.
Yes, this is a great question. And Jonathan, it's really timely because what we've been working at Dana-Farber, and we have officially rolled out is it's called a systematic screening of disability identity and accommodations, which is just a really fancy way of saying that our staff in patient registration, when they're going through collecting people's information about demographics like where they live and their age and their ethnicity and gender identity and pronouns, we are also now asking about disability identities, and also accommodations. So we're trying to get that like from the very, very beginning of someone's journey, because then that information is organized in a way on the medical chart that the providers and anyone who's having a touch point with that patient can be able to be like, oh, okay, here's the patient, here's the accommodation, here's the support person, here's the decision making, that we can have all that. And because there's also many patients who are not currently going through registration because they've previously been registered, we're also working on, okay, so how do we capture this with, all of our patients? And again, how are we training up providers so that we can be asking in a dignified way about disability identity, about accommodations, and like we ask because we care and because we want to make sure that you are truly able to access your care.
That's fantastic. That made me think of one other question too, around the number of doctors and nurses and other healthcare providers that Jonathan worked, that that cared for him during this process, and how do you really systematically get them all on board with what you're doing?
Yeah, really good question. So it's a work in process, right? It's what we're working on right now, but really having clear what's referred to as flags. It's like just clear organization in the medical chart with the disability identity, with the accommodations. And then it's also like in my role as a neuro-inclusive social worker that I'm looping in when I see that someone is going inpatient, or when I see that someone's headed to radiology, that I'm then looping in those providers to share a big picture, right? Not just focusing on the disability, but like, hey, this is the person's interests. Here are their strengths. Here's their communication. By the way, here are the sensory sensitivities and some coping strategies. And, Cookie Monster is along for the ride. Please make sure to include Cookie Monster when you're demonstrating any kind of new, procedure, prick, etc. So just trying to get all that communication, but I look forward to really working with all of you, because it is a work in process, right? And we want to make sure that we're doing the absolute best that we can.
Amazing. Thank you. Do you have any other questions, Jonathan?
Staff be trained to recognize and prioritize patients' primary medical needs over their disabilities, while also respecting and encouraging with caregivers or advocates.
Wow, that is an incredible question. And, I can try to answer it. I think because I'm not in like emergency level care, I'm sure I'm going to miss parts of this. But what I would say from my social work lens and more of an outpatient setting is that there needs to be more opportunities for training with emergency room providers. And you know what, Jonathan? We need you and we need other advocates to be the ones delivering the training, so that not only the emergency room personnel are hearing the theory and the best practices, but they're engaging in real time with people who have a variety of, communication profiles, or for people who are nonverbal, that like we need that hands-on experience for folks who are working in the emergency room. And I think that there's also a ton to be done with the electronic health records, like I mentioned to you, right? That's something that I know our Massachusetts healthcare systems are, all working on improving that disability identity and accommodations. But for sure, in the emergency room setting, you have to make decisions really, really quickly. And you're like taking in a lot of information at once. So how do we make sure that the electronic health records are showing that like key information that we need around disability identity and accommodations, and that also it indicates when someone has an accommodation for a support person, to make sure that the support person can be in that space, because it's really scary and overwhelming being in a setting like that, especially if like you're in there for quite a bit of time. So Jonathan, I throw it back to you. Lots of work to be done, and you're a person to be, leading charge on
Okay.
that.
I'm there for hours. That's why I'm so passionate about this. And uh, that's why I always say that I happen to have autism because that's not all of me at the end of the day. It's just crazy.
And Jonathan, just touching on that pain plus the intersection of autism or other disabilities that can have those very extreme sensory sensitivities. The emergency room ends up being one of the worst places. So really that I agree that the training is so important. And then the other thing that I hope that you all can do through your outreach, and I know you have so much to do, is how do we do a better job, really getting those cancer screenings done for
Yes.
people with IDD and neurodivergence? It's, we're just seeing more and more that, either people are unaware that people with disabilities need to be screened, or they're unwilling to take the time and effort. And so we'd love to prevent people from getting to you in some better way.
Right, right. There's so much to be done on that preventative side and preventative, training across the board, and also being able to work on modifying aspects of the sensory experience that can be really an overload when someone does need to come in for screening. And so yes, much work to be done there, and it's definitely something that we also have, have our eyes set on addressing too. Yeah, yeah.
Well, we are so obviously just overwhelmingly grateful for this program. I have a funny question. I 100% understand why Dana-Farber has taken this on for their patients, and really to also help the providers really understand and have a better experience and feel good about the treatment programs for these folks. Is there also like a systemic reason, like a financial reason? Are the outcomes better when you support, is there any data that supports this as well?
Yeah, it's a great question. I don't have any data on it. I would say, there's the human-centered aspect of it, right? That we want to make sure that no one is disadvantaged because of some part of who they are, because they have a disability. So that is really forefront. We have a wonderful partner in this. The CJL Foundation provided initial support to launch the program, has really, a shared passion for supporting people who are autistic and supporting people who have developmental disabilities. But if we also think about it, like, on the provider end of it, what we want are successful and timely visits. So if there's system support that we can be providing so that it is a more successful visit, right? That providers are able to get the information they need, that we're able to, if we set up a scan, that someone's physically able to get through the door, can cope with the sensory experience. All of that certainly benefits, the provider and the system as a whole. But I think that, a big piece is recognizing like there are some inequities here, some major inequities. And so that needs to be, the primary reason for pushing this along.
Absolutely. As advocates, we push that piece out front all the time, but there's always that other piece that's helpful in advocacy, which is,
Yeah.
This is effective as well and will help everyone. So
Yes. I would hypothesize, we'd have to get the study in place and look at the longitudinal data, but, I would hypothesize that the supports that we're, engaging in are effective and will be helpful down the road as well. Yeah.
well, we are so looking forward to hearing more about how this program continues to roll out and to help you in any way that we can.
Thank you. Thank you so much. Thank you, Jonathan. It was so good to connect with you, and
Mhm.
Nancy and
Yep.
Mara. Thank you.
Thank
And
you.
if
Thank you. It's our pleasure. Oh, sorry.
Oh, that's good. If people want more information, I can include it in the video when we put it up there. So like a link or something.
Fantastic. Yeah, we have our Neuro-Inclusive website that's off of the main Dana-Farber page. We have an email address for our Neuro-Inclusive program, so would love to further connect.
Okay, wonderful.
Yeah, definitely. Thank you. Thank you
you
so
so
much for your
much.
time.
Thanks,
Thank
Jonathan.
you.
Yeah, thank you.
Awesome, Jonathan.
Have a great day. I can stop the recording.
Okay.